you can't get it straight with the nurses, so I won't listen to you, and then the wound doesn't get better. So
Yeah, and like my nurse said or whatever.
right, my nurse that I've been seeing for months, and now you come over and you're changing everything. So the patient trust is very important, and that comes from clear communication between the staff and us being on the same page.
Hi everyone, my name is Mariam Treystman from the Home Health Consultant, and today we're so excited to have Dr. Robert Goldberg with us, an advanced wound specialist. Hi, thank you so much for joining.
Hi, thank you.
Can you tell us a little about yourself?
Yeah, of course. I'm actually originally from Russia. I was born and raised there, and did 5 years of medical school there. But then when I came here in 2008, I had to redo everything. 4 years of college, 4 years of medical school. So I have a double medical education. And then I was trained in cardiothoracic surgery at USC, but eventually transitioned to wound care because that's something I enjoy more.
So do you have any tips or anything for like home health agencies or hospice agencies or whatever you work with that, can lead to better outcomes for patients?
Yeah, I mean, essentially it's up to them. I'm not going to dictate what they can do or what they should do, but I think it's better to actually leave it to the professionals, if you will. Somebody who knows what they're doing, and not just these groups who can do wound care and just settle on managing it rather than healing it.
Right.
And also ruining the patient's expectations. And the mind is a very powerful thing. So also when I see patients, I tell them you have to feel that you're getting better. Like just accepting it and thinking like, oh, I'll let you do your thing and I'll wait for it to heal. No, you are the captain of the ship. I'm just helping. You're doing all the work. So if they've given up, that's
Then it's over.
almost like 50% failure.
Yeah.
50% of the effect of failure.
So if I were like a home health agency and I'm just like looking for a wound care physician or, a wound professional to come evaluate the wound, do whatever, how could I differentiate between someone who's going to be good and...
Yeah. I think it's easy as far as you should look at their credentials, because as far as I know, there's only 1 or 2 MDs who actually go to patients' homes and do wound care in LA.
Mm-hmm.
And I'm one of them.
Nice. So it's him or it's or don't do it.
Pretty much, yeah.
Yeah. No, that's fine.
But
sometimes you could be the best, and that's fine.
Yeah. And I think also not just credentialing in terms of the degree, also the background. You could also have, there's a lot of family physicians. I'm not saying that they're not, some of them are amazing at wound care, but in order to do proper debridement, not to damage any structures, nerves, or blood vessels, or make it worse, debridement is the cleaning of the wound. Mm-hmm. You should have surgical background. You wouldn't have a family physician do a cardiac bypass, would you? Yeah,
exactly.
You should have proper training. And so that the background, the training, and the last thing is you should just ask them for the track record. Like, what kind of wounds have you been seeing? What experience you have, and what experience in healing the wounds, because anybody can maintain the wounds. It's not hard, but healing actually and resolving them is what you need to focus on.
Is there like a time frame by which we can be like, this is not effective? Like if an agency is working with somebody and then like, at what point do we go, okay, we've given this enough time and you guys just suck?
I'd say a month.
Okay.
Because the wounds should be healing every day. And if in a month you either have no improvement or it's getting worse, or even if it's improving, but less than like 50% of, so in a month it's less than 50% smaller, then something's wrong.
Gotcha.
Then you need to maybe look for another provider.
Okay. So, do you have any advice or tips on how agencies can document or kind of like any tips for ADRs or anything like that?
Yeah, I think a big one is the documentation in terms of measurements of the wounds. They should be, measurements should always be a part of the documentation and along with the photos. But the big thing about the measurements, they should all coincide with the measurements that are in the documents, in the notes, physician's notes or wound group notes, because even if these wound groups send a person who's not very trained, they do get trained on how to measure the wounds and how to look at them. And in order to properly measure it, you have to correctly expose it, correctly not stretch it, but remove all the obstructions and position the tissues in such a way that the wound is exposed properly. That's just surface measurements, but sometimes if you want to measure the undermining under the edge of the wound or the depth of the wound, it also has to be done properly. So even these groups that don't have much training in wound care or in surgical debridement, they do know how to measure the wounds. At least they should.
Yeah,
And
we're hoping.
so we're hoping. So when there's a CMS review or an audit, they all look at that, at the measurements. And if you have trouble, if you don't know how to measure or you have trouble measuring, it's probably easier to just talk to the group or to the wound provider and see what their measurements are, discuss those measurements with them, and make sure those are the same and they fit each other. Because if they're different, then
It probably calls the whole thing into
it raises a lot of
question.
questions.
Yeah.
Yeah, it raises a lot of questions, and also raises a lot of questions about your agency's qualifications to do wound care. Because obviously a wound group or a wound physician, they should know how to do it, and they
Right.
have a lot of training in that. But if your measurements are different, then it raises a question about your agency's qualifications to measure the wounds or to do wound care to begin with. So
How how far after the wound professional's measurement, like obviously there's a frequency to the dressings and all
mhm,
this stuff, right? So like
mhm.
um let's say you're measuring it now 2 days later or 3 days later, right? Like this is
Yeah,
normal
it could
frequency.
change.
It could change.
Yeah, it could change, but not by a lot,
Right.
especially if it's a chronic wound. Usually and it's not getting better, or you always look at the previous trajectory of the wound healing. So if it's getting better, it could get a little better. If it's getting worse, it could get a little bit worse, but just a few millimeters
Yeah, it's not going to be
in a
like
couple
seven
of
inches
days.
difference. Yeah.
Right. I've had issues when one agency measured not just one but two wounds, and they put
As
measurement
one. Yeah.
as one, and they were like, I don't know, 20 centimeters apart from each other, but they measured as ones, like, oh, this whole area is a wound.
Yeah.
No, it's not. So,
Yeah,
but
these are
then they
two
had
separate.
this enormous measurement, and then mine was completely different from that, obviously. So that just looked bad.
Yeah, that looks crazy,
Yeah,
probably.
yeah.
So what are some things that, let's say if this symptom or if you notice this trend, like contact the wound physician immediately, like contact them now. Like what are some signs and symptoms that we need to look out for where we're like calling you immediately and not waiting for whenever the next time is?
Yeah, if you see, that's also a little difficult because you could say, "Oh, it's getting red," or there's this pus coming out of it, but it wasn't actually pus. It was just a part of the dressing
Mhm.
that just absorbed all the drainage and just looks weird, but it's totally normal. So, but if you have a concern, definitely reach out. You can just snap a picture and send it to us
I'm
and
sure your
send it to my
phone's
sister.
filled with some
Yeah.
really good camera roll.
Right, right. Just delete that picture afterwards
Right.
for HIPAA and make sure there's no identifying information like patient's face or their name.
Or name.
Just, yeah, just, because when you measure the wound, you should have a ruler next to it with the patient's name.
Gotcha.
Uh, well, sorry, when
With
you
the
take when
patient's
you
name.
when you take a picture for the medical records with
Yeah.
the proper software, the app that you download, it's part of the EMR, special
Oh,
EMR.
what kind of What's
Well,
the
there's a
app?
lot of them. It depends on whatever agency
Are you gonna plug
receives.
one?
I don't have one
No. Okay.
to plug, but because it should be specifically for home health agencies
Gotcha.
anymore. Uh,
Oh, the EMRs don't. The home health EMRs barely record notes.
so what do they use to take pictures?
Like
Their phones?
their phones, probably. I don't know. Or I don't know, maybe a camera of some sort, but
Yeah, sometimes
usually
they
not the
carry a
EMR.
camera, but there's a whole set of rules that they should be compliant
What are they?
the like a password protected
The usual HIPAA stuff.
yeah, the usual
Yeah,
HIPAA stuff.
yeah, yeah.
Yeah.
Gotcha.
Basically, so there's no identifying information unless it goes into the EMR and medical records. Then they should know, like, oh,
They
this
need to
one was
attach
for
it to
this
the right
patient. Yeah,
person. Right, of course.
yeah. But other than that, so if you have a concern about the wound, take a picture. You can take a picture with your phone so you can send it to us, but without patient's face or anything, they could identify the patient and then send it to me and be like, is it an infection? Should we send the patient to the hospital? And most of the time, I'll say no. It's totally fine. Just don't worry.
So, my dad's doctor, and anytime I call him and ask him anything, he says, "Don't worry, you're not gonna die."
Yeah.
So most of the time you say no. It's
With wounds, yeah, it's no heart surgery. There's very rarely there's an emergency with wound care.
yeah,
So, yeah,
it's a slow moving coup.
yeah, very slow, like month-long
Oh man.
process.
So what's another problem that you see with working with home health agencies?
Oftentimes, if a nurse has been seeing this patient, a certain patient for many months, and they're used to this treatment that they've been doing, and then I come over and I change it up because it wasn't the correct treatment. Some of the nurses are a little resistant to that, and they just continue doing what they're doing. And also, the treatment that I prescribe usually takes time to do, and also, sometimes when I apply special dressings, the wound shouldn't be touched for a week.
Hmm.
So they can change the dressings, but they shouldn't clean the wound, because that's part of, usually they spray it with saline, they clean it,
Right.
they apply the dressings. But if I say in my note and in my order not to touch the wound, you can replace the dressing, so you can expose it, but don't clean it because there's a special dressing on it. And I've had a lot of times when the patients say, "Oh, she cleaned it anyway because she thought the wound needs to be cleaned," or she didn't apply this dressing because she thought it's not the right dressing. And then we have to contact the agencies, and it's back and forth, and takes a few weeks to get to the point where we're on the same page. But those few weeks is the time that the patient could have been getting better,
Right.
but they're not. And they could have gotten worse in the meantime. And then they also don't give the patients the correct directions, so I have to reinforce again. So the communication is a big one, and the big one is to look at the orders and follow them carefully, because we always outline very detailed instructions on what to do and what not to do. And if you tell the patient something else, and then we have conflicting sources of information, that doesn't look good for the patient too.
Yeah.
They're like, oh, who the hell is this guy who can't get it straight? And then they won't listen to me afterwards to this important patient education. And they're like, well, you can't get it straight with the nurses, so I won't listen to you. And then the wound doesn't get better. So
Yeah, and like my nurse said or whatever.
right, my nurse that I've been seeing for months, and now you come over and you change everything. So the patient trust is very important, and that comes from clear communication between the staff and us being on the same page, and giving the patient the same information.
Is like the rogue nurse, is that ever like is that usually like a personality thing, or is it like, I don't know, they forgot to take the care plan, or like,
Yeah,
what do you think it is?
I think it's a combination of things. One is person's ego, especially in medicine. There's a lot of those especially experienced nurses who've seen a lot.
Mhm.
They like, oh, this new doctor, he doesn't know what he's talking
Yeah, yeah.
about. He's young. He doesn't know the tried and true methods of keeping the wound dry and not putting any dressings. That's what grandma told me.
There's
But no, actually, it's the opposite of truth. The wound has to be moist it has to have a lot of moisture to be able to heal properly.
Gotcha.
So when grandma told you keep it dry, and it's not correct.
Yeah. There's like a whole corner of the internet dedicated to experienced nurse versus new doctor,
Okay.
like funny real interactions.
I haven't seen those, but I'm sure it's
It,
quite a read.
yeah, it's usually from the perspective of the nurse.
Of course.
And my algorithm, I don't know why, like just started like hitting me with them. I guess it like tuned into the fact that
Do
like
the doctors ever chime in, or they don't really?
no, it's always the nurse. It's all I get the ones from the nurse's perspective.
Because you work with the home health agency.
Right, exactly. Yeah.
Yeah. Doctors have a lot of things to say too.
Yeah.
When they have nurses
We're gonna make
interfering.
those reels. Those are the ones we're gonna make some social media little clips.
That would be funny. Yeah.
Once again, this is Mariam Treystman from the Home Health Consultant. And this is
My name is Dr. Robert Goldberg. I'm the advanced wound care specialist.
Thank you so much for joining us. And if you like our content, please like, share, and subscribe.